नमस्कार दोस्तों, वेलकम टू चैनल टॉक्सिकोलॉजी ऑन बोर्ड. Today in this video we'll be learning about another DABT topic, that is the mechanism of amphetamine, the route of excretion, particularly with this particular CNS stimulant drug which is amphetamine. We are reading the route of excretion and what are the various pH conditions. What is the major route of excretion, that is urine. That we will see what the question. The question is taken from ABT recertification exam, that is May 12, 2000. This question, from this question paper, this is a typical structure of amphetamine. So the question is, a possible mechanism of excretion of amphetamine in the urine is. So we have option A, which is passive diffusion. Option B, we have ionization of the weak organic acid. Option C is enhanced by alkalinization of the urine. Option C is ionization of the weak organic base. Option E is none of the above. The right answer will be in the Greek text, that is ionization of weak organic base. Okay. So with this question, you also read about different types of transport, ion or channel transport will be there. No, which of them is ATP dependent, which of them is ATP independent, is active transport and passive transport. Also various types of and diffusion, passive diffusion will be there. No, those you read already. You can also do a revision on these particular topics also. So how urine pH is going to determine the amount of excretion of a certain drug, that also we will be learning in this video. Okay. So explanation which is given is that amphetamine is excreted in the urine through a combination of, we have glomerular filtration, active tubular secretion, passive tubular reabsorption, and all these three methods, either it is glomerular filtration, active tubular secretion, or passive tubular reabsorption, all these things are highly dependent on the urine of the pH. Whether the pH of the urine is alkaline or acidic, based on that, which method of route of excretion, that will be decided. Okay, so primary mechanisms are glomerular filtration, active tubular secretion, passive tubular reabsorption, which is totally dependent on pH. Okay, coming to glomerular filtration, like other small molecules, this amphetamine is initially filtered from the blood into the renal tubules. Okay, we have in the kidney, you can see a typical structure of a nephron. If you see in the renal tubules, this will be filtered into the blood. Active tubular secretion, the renal clearance of amphetamine can exceed the normal glomerular filtration rate. So whenever there is greater GFR, okay, more than the normal GFR is there, then there will be involvement of active transport mechanism in its secretion into the urine. So this will be ATP dependent, will be the active transport mechanism. Next is passive tubular reabsorption, which is pH dependent. Is the most significant factor affecting the amount of amphetamine excreted. Amphetamine is generally, it is weak base with a pK of around 9.8. Okay, in the body, a portion of the drug is exist in unionized, that is lipid soluble form. Okay, which can be easily reabsorbed back into the bloodstream from the renal tubule through passive diffusion across the cell membranes. The pH of the urine will determine ratio of this ionized, that is water soluble, to unionized form. So we'll see in detail. So how this pH is going to influence the rate of amphetamine excretion? It is highly dependent on the pH of the urine, as I said. Acidic, how the acidic urine is going to impact, how the alkaline urine is going to impact, that we will see. Coming to acidic urine, that is low pH, a lower urinary tract pH, urinary pH, what it will, so whenever the urine pH level is less, no, there will be increase in the proportion of this amphetamine in its ionized form. So urine pH is less, amphetamine drug will be in more in the ionized form. This ionized form is less soluble, okay, less lipid soluble, less able to cross the tubular membrane, okay, back into the blood, leading to significantly increased excretion in the urine and a shorter half-life in the body. So drug is eliminated, okay, because urine pH is less, drug is more in the ionized form, less lipid soluble, as a result cannot be reabsorbed back into the tubular membrane. As a result, more amount of drug is excreted through the urine. Now, opposite condition. Now, what if the urine pH is alkaline? In that case, what happens? When the urine pH is high, then there will be increased proportion of amphetamine in the form of unionized form. Okay, now the pH of the urine is high, drug is in unionized form, because of which what happens to the solubility? Readily reabsorbed from the renal tubules back into the systemic circulation. As a result, whatever this drug concentration will be more, okay, resulting in decreased excretion. As a result, prolonged half-life and duration of effects in your body. So this is how the urine pH is going to affect, okay, the amount of excretion of this particular drug amphetamine. Okay, so if you look into the metabolism, some part of the amphetamine is also metabolized in the liver. And what is the method? By hydroxylation or deamination. And they form various metabolites, and these metabolites are also excreted into the urine. Okay, 30, if you look into humans, 30 to 40% of this, whatever the amphetamine administered dose will be there, it is typically unchanged in the urine under normal, uncontrolled urinary pH conditions. Okay, so in addition to this uh, amphetamine and route of excretion and the pH dependent, I also gathered some information with in the textbook, that is Clayson, the 9th edition. So you also read page number 858 as well as page number 888. In this note, table 16.4, since you have to read amphetamine along with methamphetamine. Amphetamine is used as CNS stimulant, whereas methamphetamine is used as an illicit drug for various recreational activities like that. So it is a neurotoxicant. So in table 16.4, they have listed that these compounds which are associated with neurotransmitter associated toxicity. In that both amphetamine and methamphetamine are given, and the neurological findings which they have seen is tremor, restlessness, that is an acute exposure, cerebral infraction, hemorrhage, neuropsychiatric disturbances. Coming to basis of this neurotoxicity, bilateral infrax of the globus pallidus, abnormalities in the dopaminergic, serotonergic, and cholinergic system act as adrenergic receptors, acts at adrenergic receptors. Okay. Coming to table 17.4, these are some of the common signs and symptoms of the visual system dysfunction. So amphetamine was listed under this table 17.4, and it is causing visual system dysfunction. How? By possible pathological basis, what is reported is adrenergic agonist. It is causing pupil dilation, mydriasis, and photophobia. So you read this also about amphetamine. Then I have also come across table 32.3, in which they have given the distribution of the drugs of abuse encountered urine specimens in 1179 cases of alleged sexual assault. So these are the common drugs which they have seen in the case of urine sample. So in that, amphetamine is also listed, and they have seen around 51 incidences are there where where they have seen that amphetamine was one of the drug of abuse. Okay. Also, I have also come across another table, that is 32.4, in which it is given under list that forensic urine drug testing analytes and cutoff concentrations they have given. So there are various drugs are there. You can read in that. Since amphetamine, we're discussing amphetamine, for initial test, the concentration in nanogram per ml it is given 500, and confirmatory test it is 250 nanogram per ml. And if you see, methamphetamine is also listed in the table, and you can see that the confirmatory test they have given is 250 nanogram per ml. So in this, with respect to amphetamine as well as methamphetamine, also read about this drug of abuse, and you see what are the methods, how this amphetamine is different from methamphetamine. Okay, one or two questions you might get with respect to this also. If possible, try to remember these examples also from the tables, two to three, four tables which are listed in this video. No? Okay, please read page number 1521 as well as 1523 in Clayson 9th edition. So Hope from this video you were able to learn about methamphetamine, the methods and routes of excretion, how the pH is going to decide, how the pH dependent excretion is there. Okay, and also compare the structure between methamphetamine and amphetamine, the mechanism of action, what are the adverse effects. Okay, so thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. Thank you so much. All the best for your exam.